Hi, I'm Leo Lazinski, and in this video I'm going to be speaking about cholesterol. Now, I have done a previous video on the myth of high cholesterol and that cholesterol is bad for you and could harm you. So this video I want to go into a little bit more depth into a couple of the nuances on that. So over 20 years ago, when I had access to the medical library in my university days, I was quite confused because on one hand, we were taught from physiology that cholesterol was an important building block of the body, one of the most important building blocks of the body, a very powerful repair molecule, antioxidant, that the brain was between 65 and 75% made out of cholesterol, and that our nervous system was coated in a sheath that was primarily made of cholesterol. And then suddenly, there was an idea that cholesterol was actually harmful and it could kill you. Okay? And so none of this made sense. You can't have a molecule that is so important for our bodies and suddenly it's going to kill you. So I started looking into this, and those were the days where it was a lot more controversial to be questioning the cholesterol story and the lipid hypothesis. But I did it anyway, and none of it made sense. Now it's been 20 plus years since, and there's a lot more evidence to show that cholesterol is very helpful, that it's necessary, and that it's one of the most important fundamental building blocks of the body. So just to give you an idea, about 70 to 80% of the cholesterol that's floating around our body is made from our livers. Now, our body needs it so much that it will do whatever it takes to actually make it. But because cholesterol is a repair molecule and a healing molecule, if there is a lot of damage, inflammation, or any sort of issues in the body that needs repairing, it may lead to an elevation of your total cholesterol in your blood. So the cholesterol isn't the cause of anything, it is a response. Now that doesn't mean that the numbers that they're testing in you are accurate or correct, or the levels are meant to be helpful, because those levels are designed to medicate or put a pharmaceutical in there to drop it. That's why they test them. But cholesterol is designed that if you have an acute infection or acute injury or some physical trauma or even emotional trauma, that it will rise. So if it is continuously elevated, it is a sign that something needs to be done in the body. So cholesterol isn't the cause of anything, it is a vital molecule for healing, repair, and overall wellness and well-being, especially brain function and brain health. So trying to go on a low cholesterol diet or lowering your cholesterol will be harmful long term. What the medications do is they block the liver from producing cholesterol, and that's terrible because your body's actually trying to produce it for a reason. I mean, it's well known that if you were to take cholesterol lowering drugs, you cannot get pregnant. That will cause major harm to a baby. If babies are born or have a mutation that they don't produce cholesterol, they don't survive. So we understand the importance of it. So it is absolutely absurd that we have physiology on the one hand telling us facts about something, and then pharmaceutical medicine telling us the opposite. So I would advise you to use your own logic here and reason here and realize the importance of cholesterol. And we're seeing over the years, between say 30 years or so of trying to lower cholesterol, how it's affecting many people within their mental health, in their old age, with their brain function and their nervous system and their overall detoxification and immune systems. We're seeing a complete degradation in this front, and along with that, a reduction in fertility, because cholesterol is vital for the production of fertility hormones, sex hormones, libido, and the production and the creation and the development of a healthy fetus into a baby. So take that on and start looking at ways to have a healthy body and stop worrying about your cholesterol numbers. As there's a famous saying that says the best way to never get high cholesterol numbers is to stop testing.